Sofia Monsalve from FIAN on gender, nutrition and the human right to adequate food. Sofia.
Thank you very much, Ben, and thank you to ISS and TNI and the ICAS and the whole people who organized this colloquium. Well, first of all, I have to say that I'm here replacing Flavio Valente. Flavio Valente is the Secretary General of FIAN. He's a medical doctor from Brazil who has devoted his life for the struggle of nutrition and the human right to food and food sovereignty. So it's important that I say this because what I want to present to you today is some insights of our research that FIAN has conducted in cooperation with the University of Hohenheim on gender and nutrition and the human right to adequate food. And I think it's important for our discussions here because those of us who have been working on the right to food and the connection with food sovereignty have always had the sense that well, since we were working on right to food issues and the right to food is a universal right, we were touching upon several issues which the food sovereignty movement were not touching a couple of years back. Of course, it relates to the issue of workers, of income, of social policies, because not everyone can produce food. So even though we have a strong and historic commitment with the right to feed oneself and the part on producing food, we are very much aware that that's not the end of the story. And for us, it's very important to see now how the framework of food sovereignty has evolved and has started to taking into account much more complex issues. So we think that this research on gender and nutrition is going to be part of this ongoing dialogue between the right to food and food sovereignty. And it is important because, let me briefly tell you the main insights of this research. The first one was to look first at the normative basis of the right to food of women and girls, and to ask why is it that there is so little progress made in terms of improving the food and nutrition situation of women and girls. And one of the first things to remark there is that on the normative part, we have a very fragmented framework because in the economic and in the Covenant on Economic, Social and Cultural Rights, women are more or less invisible. They are not very strong there. And then we have, of course, a particular instrument, the Convention on the Eradication of All Forms of Discrimination Against Women. But there, women are, the right to food of women is, if you want, reduced to the cases of pregnant and breastfeeding women when it comes to nutrition issues. Of course, this convention talks about the rights of women to productive resources and to income, but when it comes to right to food, we have seen that there is a tendency to really reduce the role of women to motherhood. And to talk about just pregnancy and breastfeeding. And we know, of course, from the side of the social movements working on health, that the first 1,000 years in life of every human being, of every human being is the most critical phase for the entire nutritional well-being of people, and therefore is a crucial, of course, time span for this. But it has been addressed in a way which is highly medicalized, in a ways which is about technical interventions. And has neglected the social determinants of nutrition, and has, of course, neglected structural causes of malnutrition and undernourishment. So this is very relevant because when it comes, for instance, to the nutritional situation of women and girls, this research has discovered that one of the most important aspects there is the violence against women, and in particular the issue of child marriage, because there is a very strong connection between child births and of girls which are severely malnourished, and of course they are likely to give birth to very low weight babies, which of course have a very short life expectancy, and of course are prone to diseases of malnutrition, but also we have seen now of obesity. So this is very important because the health movement working on nutrition issues and fighting heavily against the pharmaceutical and transnational quick fixes for nutrition feels quite isolated from the food sovereignty movement, because the food sovereignty movement is just focusing, as I said, I want to be provocative, on the food production part of that, but not on the health and nutrition part of that. And I think FIAN, through the work of Flavio, is now heavily engaged in trying to bring these two movements together to have a dialogue, because it's becoming very important. If you take, for instance, initiatives like the G8 Alliance and AGRA, the nutrition component of that, in terms of bringing the multinational and bringing these highly medicalized products to address these nutrition issues, is quite big, and it's a big door for these companies to come into this market. So this is the new program that FIAN is working now on, that we are trying to build up, and as I said, is about bringing together these two big the movement on health and the gender movement to talk about these issues. Well, I think it's important to say that we have this forum is, I think, an important forum to address these issues, and that I remember when I was a young person starting to work with Peter and with Michel Winfur, I remember that we discussed several of the issues right now here, but at that time it was more or less a taboo. You were not allowed to talk about other issues, social policy, labor, income, and I'm very happy to see that we have somehow broken that taboo, that we are now openly discussing about these issues, and I'm very confident that we will that this will strengthen for sure the movement. Thank you very much.
So we have exactly half an hour.